All right, everybody, welcome back to another episode of the AFS Health and Care Podcast. I'm delighted to be back here with my co-host, Michael Stack, business partner and health science expert, to get us up to speed on the latest and greatest evidence-based news out there. So today we are going to talk about mental health, believe it or not. You've talked about attaching the exercise process to what happens from a mental health standpoint as opposed to physiologically. Meaning, most people that start exercising, they start exercising for a long-term physical health outcome goal, losing weight, building muscle, rehabbing an injury, whatever it may be. And that takes a long time. You reference when you start to exercise or move, there are immediate mental health benefits that happen. Talk about that.
Yeah, the story I think that we've been told with regard to exercise over the years, and it's not an incorrect story, it's just an incomplete story. The story that we've been told over the years is exercise is for your physical health benefit. And physical health could mean weight loss, it could mean preventing or treating cardiovascular disease, diabetes, living longer, whatever the physical health benefit is. And as I said, that's not incorrect. That is absolutely true. Exercise does do all those things. It's an amazing polypill. But if you think about all of those things, and let's go with the most extreme here, living longer. That literally takes a lifetime to manifest itself. And if it's losing weight, weight loss takes weeks to months to years in some cases. And not that those are bad goals, but the challenge is it's very distal to when you perform the exercise. Like I do a workout today to help me live longer 50 years from now. It really works against the way our brains are wired from an instant gratification standpoint. And this really goes back to some fundamental concepts from evolutionary biology. And I've always been a student of evolutionary biology because I think it teaches us a lot of the ways our brain works on a subconscious level. And evolutionarily, we wired for instant gratification because that's what kept us alive. It's what ran us away from the tiger. It's what caused us to procreate. It was caused us to, eat the honey so we had energy to fight the tiger or procreate or whatever it might be, right? So it's very, very subconsciously and biologically ingrained. Well, fast forward to present day where, a lot of those things aren't as salient of issues. We're still wired for instant gratification. We know this because we expect the Amazon package to arrive today. We love the Facebook likes and then the hearts on Instagram. But if you think about that and then you kind of apply that instant gratification logic to the standard motivational paradigm around exercise, it really starts to fall short because me living longer and me preventing heart disease 10 years in the future, or me losing 25 pounds a year from now or 6 months from now, there's no instant gratification associated with that. Yet there's all kinds of things I can do in the immediate environment that are instantly gratifying. For example, I can sit on the couch and I can watch Netflix. I can eat a Jets pizza. I can have a sleeve of Oreos, whatever it might be. You'll definitely derive instant gratification from that. So if we can shift our paradigm and if we could start to associate the immediate benefits of exercise with its performance, then all of a sudden we're working with our natural evolutionary biology tendency to want instant gratification, not against. And what I mean by that is if you exercise, and we've talked about this, you will feel better. I promise. You will think better. You will think more clearly. Your symptoms of depression and anxiety will reduce. There's all of these beneficial things that happen when you exercise that are proximal to its performance. They are the immediate benefits of exercise, and they are the mental health benefits of exercise. So if I can, instead of associating the benefits of exercise with something that's going to happen in the future, maybe, right? Because you could exercise to live longer, and you can get hit by a bus, and then you're not living longer, right?
So true.
You can, exercise to prevent heart disease, but your genetics could be stacked against you. So we can't always be certain that the distal reasons that we're exercising will actually ever manifest themselves. However, I can guarantee you, under the vast majority of circumstances, if you exercise, you will feel better and your cognitive performance will be better. You'll get all of these mental health benefits from it. And if you could start to realize that as the benefits to exercise, now all of a sudden you are receiving instant gratification from doing your exercise rather than delayed gratification that's going to exist from focusing on the physical health benefits. Again, excuse me, not that the physical health benefits aren't important, because they are and they do occur, but what I would submit to everybody listening is that you're not going to get those benefits if you don't do the exercise. And the way to keep yourself motivated and the way to develop a good intrinsic sense of motivation is to attach the immediate benefits you're getting to exercise to its performance. And those immediate benefits are mental health benefits.
What is the mental health pill, and how do you bring that into the equation when you talk about exercise and movement?
Yeah, well, I think, this fictional pill existed that
you selling these pills?
I actually am. I have been for over 20 years.
Oh, wow.
If this fictional pill existed that, improved your depression, improved your anxiety, improved your confidence, your self-esteem, your cognitive performance, increased your endorphin levels, your levels of chemicals in the brain that allow you to grow new nerve tissue, like all these great things, it would be the greatest selling drug on the market. Yet, we know this isn't found in a pill. We had our conversations last time around the GLP-1s, which are, found in a shot. This is what exercise does. Exercise is truly the mental health pill. And when you compare it to exercise in particular, I know we've talked about the distinction between movement and physical activity and exercise, but just to remind everyone, exercise is a subset of physical activity or movement that is generally more intense. It's planned, it's intentional. It's what we typically think of when we think of people moving to improve their fitness. Exercise in particular has been shown to outperform outperform in some studies or perform at the same level in other studies common psychopharmacological drugs. So the common things people take for depression and for anxiety, if you look at the research, you find that some sort of talk therapy, and particularly when we're dealing with a mental illness, like talk therapy is very important, and that's certainly something that exercise can never replace. But that being said, if you pair talk therapy with a pharmaceutical intervention and you pair talk therapy with appropriately prescribed exercise for whatever the mental illness is that you're treating, you see either the same results or you see better results with the exercise and talk therapy intervention. Now, if it's better, I think everyone would agree that, okay, great, like exercise plus talk therapy equals better than pharmaceutical intervention. Great, go that route. But even let's think of it being the same. And so somebody might say to me, well, if it's the same, like in those cases it is the same, isn't it just better to do the talk therapy and take a pill? And what I would remind people is that any psychopharmacological medication comes with side effects. Like yes. We know that. And unfortunately, the more significant the mental illness, the more robust the pharmaceutical intervention, the greater the side effects are going to be from those pharmaceutical drugs. We know a lot of people that don't even want to take psychopharmaceuticals because it causes so many side effects. The side effects to exercise are only positive side effects. Like if you are exercising for your mental health, you might also get stronger, get more aerobically fit, build muscle, lose fat. So it's when you start to think about things from just from an overall efficacy perspective, you really start to get a sense of how potent exercise is. And I'll point everyone listening, and maybe we can link up to this on our show notes page if one exists. Do we have a show notes page?
It's coming, Mike.
It's coming. The J.W. Brick Foundation for Mental Health. Victor Brick, who runs the Brick Foundation with his wife Lynn, they are Planet Fitness Master franchisees. So they own a bunch of different Planet Fitnesses, and Victor's brother John was schizophrenic, and he ended up dying from schizophrenia. And and that really kind of shook Victor, and he said, I want to do something for the mental health community. So they developed the J.W. Brick Foundation for Mental Health, and they published, I believe it was last year, or it could have been the year before, the Move Your Mental Health Report. And it is what I would call kind of a non-academic meta-analysis. In academia, meta-analyses are studies of studies. It's like let's aggregate all the studies on exercise and depression, and let's put it into one study, and we call that a meta-analysis. We look at effect size and things like that. Well, the Brick Foundation did this for the general public, so it's not published in an academic journal. And this thing is like 80 pages long. It looks at the synthesis of all the research that has been done on exercise and mental health for specific mental illnesses. Depression, anxiety, schizophrenia, alcoholism, so on and so forth. And the report really shows some just incredible findings of the potency of exercise. And the Brick Foundation even found it to be so illuminating and exciting that they've just recently, and this is within the past 3 months or so, they have developed and launched a mental health certification for exercise professionals to teach exercise professionals the specific protocols you would use for depression versus anxiety, which we can get into broadly speaking some of those protocols. But I think to circle back around to this whole notion of like the mental health pill, for years I think mental health is progressively becoming more on the forefront of the healthcare landscape in our country. I think we're realizing that more and more, certainly post-pandemic. I think it's really shown a light on how pervasive mental health and mental illness is in this country. And so now I think researchers and practitioners alike are starting to realize we need cost-effective, side effect minimizing interventions to improve mental health and treat mental illness. And exercise is as potent of a vehicle as you can get for it when it's prescribed appropriately.
Mm-hmm. Yeah, that's interesting. You think like the two industries, the traditional talk therapy, mental health industry that most people think about, and the fitness industry, they don't work too much together, like synergistically. Do you see a lot of this research with how exercise and movement affects mental health? Like, how is this going to influence those two industries maybe coming together?
Well, I mean, now you're talking about a lot of the policy and systems change work that I do. And I mean, ultimately, where it stands right now, it is on the shoulders of individual providers on both sides of the fence to forge those relationships. It's on the psychologists and the psychiatrists that are out there to find qualified, trusted community resources in the form of exercise professionals and facilities. It's on the exercise professionals and the facilities to find mental health professionals and providers that are open to prescribing exercise. It's interesting. When I say we, I sit on the board for the Michigan Fitness Association, which is the trade association for fitness clubs in the state. And 2 years ago, we surveyed the mental health professionals in the state of Michigan, and we asked them, if they thought that exercise should be a part of their treatments. Do they integrate it into their treatments? And what we overwhelmingly found was that the vast majority of mental health providers in the state of Michigan that we surveyed said that exercise is an important part of a mental health treatment plan. But we also asked the question, do you implement exercise as part of your treatment plans? And a minority of people said they did. And the reason they said that they didn't do it was because they didn't feel like they had the knowledge to do it effectively. And I understand that. We know from just standard healthcare settings with physicians that there's very minimal training on physical activity and exercise. I don't know the research in the psychology community. I don't think it's actually been done how much of a psychologist's educational curriculum goes to exercise. I would venture to say it's probably less than a medical doctor, and it's scant there. So I think there definitely is a knowledge gap that exists. And so right now, I think it has to be a very manual effort on the part of both sides. As time goes on, and as physical activity assessment becomes a more routine part of healthcare assessment, it's progressing towards a vital sign. And I won't go down that path too much from some of the work I do with Physical Activity Alliance. When it's in the EHRs, and when there are trusted, qualified resources in the community that providers can refer out to, I think it becomes a much easier process. But again, right now it's on the the psychologist to find the exercise professional, the exercise professional find the psychologist, or it's on the consumer that's listening to this that's dealing with a mental health issue to say, I need to find a qualified exercise professional to prescribe an appropriate program for me. And if somebody's listening and they're looking to do that, I would point everyone to the United States Registry of Exercise Professionals, which is usreps.org, and there's a registry that you can look in your area who the registered exercise professionals are, and those would be the first place to start in terms of finding a qualified provider in your area.
Yeah, well said. And also too, you don't need to read a paper to experience the effects here. Most people, if you go walk outside on a relatively nice sunny day, 10 minutes, you are going to feel way different. And that's the thing. I think people that are listening to this are people that have a lot of real life situations going on. They're dealing with family members, work, kids, aging parents, a lot of life stresses that come into play. And whether it's a full-blown exercise plan or just finding time to get outside and walk, it's more of a something is better kind of thing, right? You referenced the what's your potato reference, dude? I know people can't see this.
My potato reference. My potato reference is that you don't have to go from eating a couch potato to a jack potato to see significant improvements in your health. You just have to be a slightly more active potato. And then that metaphor is much enhanced by the clip art I use in presentations. So we lacking that clip art here.
Maybe Nick can put that on, dude.
Maybe you can.
I think so. All right, I want to get to this this model of languishing and flourishing, and then we need to get to some practical takeaways for people.
Got it.
Can you talk about that model? What is languishing? What is flourishing?
Yeah, I think this is probably a more salient conversation to have because, yes, mental illness is a problem, and the statistics will tell you that roughly 1/5 of our population in any one given time has a diagnosed mental illness, and I'm sure there's a lot more because of the lack of mental health providers that have a mental illness that don't actually have a formal diagnosis. But saying that, that's not the majority of the population, thankfully. But I think the rest of the population that is not dealing with mental illness can think of their mental health on the continuum of languishing to flourishing. And when I think of languishing on that end of the continuum, I think of general apathy, just general loss of interest in things in life, not to the severity of depression, but just really the way to think of it is you're just going through the motions. It kind of feels like you're stuck in the mud. One day, kind of bleeds into the other. Your motivation is low. Your empowerment is low. You don't feel like you're living the good life, or you don't feel like you're running on all cylinders. That's languishing. And I think a lot of people experience that to a degree during the pandemic because, the pandemic constrained us to a great part. Socially, it prevented some people from feeling like they could exercise autonomy over their life. And I think there has been a carryover effect of, languishing into the post-pandemic period. And, to be clear, unlike depression or anxiety that, you can go into the literature and there's actually diagnostic criteria for it. There's not diagnostic criteria for languishing and flourishing, at least not yet. But I think everyone understands the state that I just talked about, which is, you just kind of feel ho-hum about life. Ho-hum. And then the other end of the spectrum is flourishing. And I think, this draws on the work of Martin Seligman, who's the father of positive psychology. In fact, he has a book that's called Flourish that I recommend everybody reads. It's a great book. And basically, this is when you're running on all cylinders. It's the direct opposite of everything I said. You have a high level of motivation, high level of autonomy, high level of empowerment. You feel like you are really making a difference in the world, and you feel like you have agency over things in your life. And I think that's the state that we all want to be in. Not only do you feel like you're leading the good life, but you also feel like you're making a difference in the good life you're leading. And this is where I really like to get people to think about the role of movement and exercise in on that languishing, flourishing continuum. If you are among the population that is lucky enough, fortunate enough to not be dealing with a mental illness, that still doesn't mean that exercise and movement can't play a role in amplifying your mental health, but it's not on the continuum. It's a two continuum model we like to think of. There's the mental illness, mental health continuum that you can think of, kind of horizontally. And then there's the languishing, flourishing continuum that you can think of vertically. Ultimately what we'd want to be in the upper right. We'd want to be, high mental health and high flourishing. Exercise can help address both. As we've talked about earlier, it can address the horizontal continuum of mental illness to mental health, but it also addresses that vertical continuum of languishing to flourishing. And if you look at the research and you look at and just anecdotally the people around you that seem to be leading the lives that seem to closest resemble a life that would be flourishing, those are people that do largely incorporate movement and exercise in their life. And I think that that's where it can be very potent. And if you're looking to get more out of life, engaging in health behaviors, sleeping better, eating better, avoiding substances, exercising, those are all ways to amplify your flourishing. Of all the things I just said, exercise is the most efficient thing that you can do because, and you've heard me say this before, the physical activity guidelines for Americans suggest that you should be moderately to vigorously active for 150 minutes per week. None of those other health behaviors I mentioned, if you only did them right for 150 minutes a week, are going to confer the same benefit that exercise does. So if you're looking to get to a higher level of flourishing, or if you're looking to move away from the languishing end of the spectrum, I would say there's no more efficient way to do it than incorporating some degree of movement into your life.
Yeah, well said. So let's stay on that and get to some practical activities or takeaways from this talk. When we think about flourishing and being in that right quadrant for mental health and max flourishing, what are some practical key takeaways that our listeners can start to implement?
Yeah, so I think we'll touch on that, but I also want to make sure, because we have talked about mental illness in this episode, and I think we do have to be really clear of, generally speaking, what some of the exercise parameters are for mental illness. I think that's important. But as far as flourishing goes, I think I very much approach this from the perspective of meeting people where they're at. So if you're not doing any moving right now, which, they're based upon the statistics that exist from the CDC, we know there's a 1 in 2 chance that the people that are listening right now are not doing enough moving. We know that only about 50% of Americans meet the aerobic guidelines for physical activity. So if you're not moving, start moving. And as we've talked about before in this podcast, and as we coach our clients here a lot, going from doing nothing to something is where you see the biggest benefits in mental and physical health. And that can be just general movement. You mentioned earlier, going for a walk outside. There is a very strong correlation between movement and being outdoors and how that confers an additional mental health benefit. I have a really good friend of mine, Dr. Melissa Sunderman, who's a lifestyle medicine physician who affectionately calls herself Dr. Outdoors. And she talks about the idea of forest bathing, which is actually it's a East Asian practice of being out in nature. This doesn't mean you get to go out in the forest and bathe in the middle of nowhere. That's not what I'm suggesting for you, Kemper. Yeah. But this idea of exercise outdoors, that even amplifies the effect of movement and exercise. So I think it's meeting people where they're at. I do think, as you look at all of the mental health benefits of more structured, intense exercise, particularly aerobic exercise and strength training, you do start to see those be associated with higher levels of mental health and higher levels of flourishing. So incorporating 2 to 3 days a week of aerobic exercise at 60 to 90% of your max heart rate, 1 to 2 days a week of strength training, done in a good structured fashion, or doing some sort of circuit training, where you're combining resistance and aerobic exercise, 2 to 3 times a week. But Everything I just said they're guidelines. They're not rigid rules. And I think whenever I talk about public health guidelines for exercise, I always try to be cautious, letting people know that it's a recommendation. It's not a commandment. And I think as long as you are moving as much as you can and however you can do it during your day, even if it's broken up into 10-minute bouts where you walk around the building a couple times during the day, I think those things could have profound impacts on your mental health and on your flourishing. But don't take my word for it. Go do it. Like, just pay attention. This is I think an interesting thing to note. I don't think we pay attention to how we're feeling enough in life.
We're going deep now.
Yeah, I don't think we notice how we're feeling at any point in time. Like, sometimes I don't think we realize how bad we're feeling until we start feeling better. So I think it's good to be mindful of how you're feeling pre taking a walk outside or pre moving, and then be mindful of how you feel after you've done that. Mm-hmm. And I guarantee you, I can't guarantee a lot in this world, but I guarantee you, if you pay attention to how you're feeling before you move and you pay attention to how you feel after you move, you will feel better. That's one thing I could confidently say.
Yeah, I agree. I agree wholeheartedly. And I know we poke fun at me for this, but for those watching and listening, I set up a walking mill at home, my home desk, and I would go, before I would do this walking mill bout, I'd wake up and I'd have from 5:30 to 7:30 to, do work or read or whatever. And I would always do it sitting down. And then I would, get Gracie up and get her situated. But the last few months I threw this walking mill in the mix, and I do that same routine, but now I'm walking at a super slow pace. And I can't tell you how much more alert I feel, how much more like I'm not tired going to get Gracie. I feel way more productive. My cognitive ability just seems to go through the roof. You do feel much differently. Before we close out, I do want Mike to talk about some of the general guidelines when it comes to exercise relative to mental health and mental illness. So can you explain that a little bit more in depth?
Yeah. And so the first thing I want to say is I'm talking about exercise as an adjunctive therapy for a mental illness, is that it should be done in conjunction with talk therapy. If you are looking for a good mental health provider, there are many in your community. This is something that an exercise professional is qualified to provide an evidence-based program for depression or anxiety, but they're clearly not qualified to help address all the other mental health issues that exist with depression or anxiety or whatever the condition would be. So this should be done in conjunction with a qualified mental health provider. But I did want to provide some general recommendations on depression and anxiety in terms of exercise. So if you think about those two conditions, which are by far and away the most prevalent mental illnesses that exist, with depression, you are in a state, a down-regulated state. And with anxiety, you're in very much an up-regulated state. So this informs exercise prescription a little bit. So we know from the research that somebody who is depressed should be aiming to try to do higher intensity exercise that increases their heart rate, increases their breathing rate, raises up kind of their overall level of energy and function. So we want something that is highly stimulating. So this is where I think aerobic activity works very, very well. Circuit training, I think, works extraordinarily well, particularly if you can pair it with circuit training in a group-based setting around other individuals that you're comfortable being around. You get both the social benefit and you get that kind of elevation benefit of exercise. So we want, for somebody who is depressed, we want exercise to be stimulating physiologically for that individual. So that would suggest anything that gets your heart rate up, like aerobic exercise, high intensity interval training, circuit training. Now, certainly the two caveats that I'll bring in there is, one, it needs to be appropriate for your fitness level and your ability level. So it may need to be modified, and that's where a qualified exercise professional can help you. It also needs to be something you enjoy. Because for me, as an example, I am not an aerobic exercise person, and if I was in a position where I was dealing with, depression, I don't know if doing aerobic exercise would make me less depressed. It might
probably make you a little bit more.
Yeah. So you do have to find something that is enjoyable, and it has to be in the appropriate social setting. But for Depression, we want stimulating exercise that raises the heart rate, raises the breathing rate, and just raises the body's overall level of activation. The reverse is true with anxiety. Right? We know that a symptom of anxiety is racing heart rate, heart palpitations, and things like that. So we would want more calming exercise for those individuals. In fact, we do have to be very cautious of significant elevations in heart rate in people that are dealing with more severe cases of anxiety, because panic attacks quite often start with a modest elevation of heart rate, palpitations, and then it becomes almost as so severe from a cardiac perspective. Sometimes people will think they're having a heart attack when they're having a panic or an anxiety attack. So I think in that case we're looking at more calming exercise. So maybe that's strength training that doesn't quite increase heart rate as much. Maybe that's mind-body exercise like yoga, Pilates, Tai Chi, Qigong, those kinds of things that move the body but do it in a little more gentle way. So again, going back to the fundamental premise, if anxiety is amplifying and activating the body state pathologically, we want exercise to move the body but in a way that depresses it a little bit. Whereas if somebody's dealing with depression in an underactivated state, we want exercise to activate it. Now, again, it has to be done in a safe environment. It has to be safe for someone's physical abilities. It has to be calibrated to what they're capable of doing. They have to like it. I mean, all those things need to be true. But if we're thinking about this broadly, just from the perspective of what we're looking for exercise to do, for depression, we're looking for exercise to stimulate. For anxiety, we're looking for exercise to calm.
Well stated, Mike. And first of all, you guys, thank you for listening. Mike, thank you for the insights. We're going to link what Mike referenced in terms of articles and links in the bottom of the page, whether it's the show notes of the podcast or if you're watching on YouTube, we'll link that below. But Mike, thank you for coming on. Thank you for watching and listening. We'll see you next time. And that's our show for today. Thank you so much for sticking around, watching, learning. If you extracted some value, please share this with your friends and family. You can also click the subscribe link. I believe if you're on the Spotifys and Apples and you're listening to this, there's a subscribe link at the bottom of the episode. If you're watching on YouTube, bottom right of this video, you can click subscribe to stay up to date on the latest episodes. Thank you again for joining us on this episode. And with that being said, be well, stay connected, and take care of your health.